Hi everyone. This afternoon I am going live with Dr. Maryam Zamani, who is a fabulous oculoplastic surgeon. That means she's a plastic surgeon who specialises in eyes. And we are going to be talking about, as well as the eye surgery, she also does lots of cosmetic doctor stuff, you know, the injectables, whether it's all the way through to things like PRP and laser and all of that. Anyway, the guinea pig is asking, now Maryam, is this you coming in as the guinea pig, or is that the guinea pig? Because I'm not sure I'm going to let, should I let Fiona on as well? We'll have a whale of a time. And we're going to be talking about how you can keep, because all the treatment clinics are closed now, and obviously nobody can have any procedures, and we've all got other things on our minds than procedures just now, what you can do to keep the effects of treatments going until such a time as treatments are open, treatment clinics are open again. God, sorry, I can't talk straight today, can I? And also, she thought it would be fun if we did a facial, if she took me through a facial. So I've got some products lined up. I think she has too. Shall I go back and see if that was indeed, if I missed it? Maryam, I'm really sorry. If that was you, do I just, Dr. Maryam Zamani, there we go. Let's let you in. And we've got some questions which some of you have kindly to those. And we'll do that all with a bit of chat along the way. And I hope you're all having a nice start to this Easter weekend. Maryam,
hey. Sorry, I had no idea. I thought we were doing it on mine, and then now we're on yours, which is totally fine. So that's great.
Oh, fab. Sorry.
It's okay. It's even better. How are you doing?
I'm doing very well, thank you. Doing very well. All the better for seeing you.
I know, me too. How has your Easter Friday, Good Friday been?
Well, working from home, which I've done for a very long time, and running a small business, which I'm desperately trying to keep going. I am at my desk and have been all day, which is a bit sad, but you know,
I know the feeling. Well, I'm excited to be here today, so thanks for having me.
Not at all. Thank you for taking the time out. I know you've got your children to manage. And now, what was the exercise you were tagging me in earlier? Is this the plank?
It's a plank. It's just a plank. You can do any plank any configuration you like, but I know you like your exercise and you're just a yogi and everything else, and I want to see those amazing biceps that you always have out.
Thank you.
Yeah.
Because I thought it might be the NHS 5-minute plank challenge.
Oh, is there one? I didn't know that. I thought there was an NHS 5K run, but I didn't know there was a plank challenge too.
There is. Well, I saw Claire Coleman doing there's a wall sit. You can either do a wall sit or a plank. Anyway, I thought it normally takes me a few weeks to work up to 5 minutes for a plank, so I may not. We'll see.
5 minutes is going to be a hard time. Ooh.
Hello. All these lovely people. Hello, everybody who's coming.
Hi, everybody.
Oh, hey, Mel. Good to see you there. If anybody doesn't know Mel, her Dalmatian back home has had lots and lots and lots of puppies, and they are the cutest. But now, Maryam.
Yes.
To your expertise, which is what we want you here for. We were going to chat about the things we can do while we're stuck at home to prolong the effects of treatments that we can't be having now.
Absolutely.
So what would you suggest for that?
So I would say, for instance, I mean, like a lot of people come in for botulinum toxin and so for injectables and things like that. So one is that there's no way to actually prolong the how long they're going to last, but you can get the condition of your skin better so that you don't notice the effects of them wearing off so much. So for instance, in the glabella, in this area in between the eyebrows or around the eyes, especially now, I mean, it's a gorgeous sunny day and the sun's out, we tend to frown, we tend to squint, and, you know, wearing sunglasses is important, but also having skincare products that have different sorts of ingredients that help to lock in the hydration and exfoliate well. So if you have a nice exfoliated base to start with, then you can add some nice ingredients that will hydrate and plump up that area and also help build collagen. So obviously any fine lines and wrinkles will become less diminished, they will become a diminished, not less diminished, they will become diminished.
And less obvious. Yeah, that's a good point. And then things like retinol.
Well, retinol is, I think, something that everybody should be on at, basically from their 20s onward, depending on the strength. But what I would say is basically, I would say, having a nice exfoliation, then using things that have peptides, ceramides that lock in hydration and moisture, especially around the eye area. I think that people often forget to do their upper eyes as well. And this is really important for that skin that starts to tend to, not a hangover, but it's like there's a little bit of excess skin at pretty much as early as your 30s, and in some people even younger. So if you can remember to do that, not be too aggressive. And then also give a nice massage. I use my pinky, or don't look at my unmanicured hands now since I haven't had a chance to do anything, but gently tapping outwards for like lymphatic drainage, especially now because of all like the pollen and the nice spring that's finally sprung. But I think that's really important. Retinol at any age, starting off with a retinol over the counter is more than enough. So I always say, obviously, as you know, to acclimate your skin. So if you're going to be starting with a retinol, especially in the sunny time, remember to always wear an SPF, which you should wear anyway, but also start off slowly. So I would say don't use it, every day. Use a small amount. Use it on your face, your neck. People often forget their neck, and also their décolletage. And anything extra, I always rub in my hands right now.
Always, yes.
So, yes, always. And, if you are really proactive, you can even put it on your body. So that's a whole different thing. But anyway, I would do a small amount on all of those areas. If it's a cream base, you use it first after you've washed your skin in the evening. And if it's more like an oil or something else, then it's usually the last layer. Anything oily, obviously, you want to place on at the very end. I'm so shiny because the light has changed. I might move my chair for a second.
Now we've got a couple of questions. Mel is saying, what does the retinol do? Mel, it sort of improves all the processes in the skin. So in older skin, it stimulates the speed of cell turnover. It stimulates the production of collagen. It helps bring down pigmentation. It reduces oiliness in the skin.
It's really a powerhouse ingredient that everybody should be on. I mean, I think it gets a bad name sometimes because people say, oh, it thins the skin. It doesn't thin the skin. Like I said, in the time that it takes to get acclimated, you can become a little bit dry and flaky. And if that happens, you can use it, less of it, but same frequency, and slowly build it up. Remember, you're trying to do this as like an ongoing good skin health. And so you don't need to be overly aggressive, and you can slowly get to the point where you're not flaking. And being indoors right now, being quarantined, and you can afford a little bit of, if you do have a little bit of downtime as well. But I think that that's like really an ingredient everybody should be on. And I would highly recommend it to everybody. I saw that it said different strengths. So if you're starting, I would start with over the counter, and there are different ones out there on the market. Whether you like a cream based, whether you like, if you have, or it's more acne prone, you could go and get a different, which is over the counter at any drugstore. I like SkinCeuticals as well, and I don't have mine here, but MZ Skin has a 2% encapsulated retinol oil, so it's great for even those skins that are maybe a little bit more mature and don't want to have that dryness. So it gives that extra hydration and locks it in the oil in the evening. So those are sort of my three favorites. What do you like using?
Retinol. I like the stronger ones from the Medicate range. They've got
they have a nice one as well.
Somebody was asking where to start with, and they have a nice one called Retinol 3TR, which is a slow release, not too strong retinol. Somebody was asking about percentages. I mean, it so depends on the formulation, so it's quite hard to say go for this percentage, because if it's really direct, it's going to hit quite hard. But if it's mixed in with squalane and oils and goodness knows what else, then it's not going to have half the effect. So I like their crystal retinol, which is a blend of retinol or retinaldehyde and something else, and then they've got their R-retinoate intense, which is they're really expensive though, those ones. What else do I like? There's, well, I got a Dermatica one, which is nice. Do you know Dermatica? They're an
No, I
online.
don't know. No, I don't know that brand.
They're an online pharmacy. They do the online dermatologist consultations, and then you send in loads of pictures, and then they
to help prescribe it for you.
compound you a thingy, a cream. So it'll be, I don't know, for me, it was a bit of hydroquinone for pigmentation, and then it was a bit of retinol. And, you know, that's great. I mean, retinol, it was tretinoin. So that's a very direct hit.
Yes.
Prescription strength. But my skin has built up to over the years. Or I like, what's that new Skin Better one? Alpha Ret. Do you know?
Yes,
do you know
I do know that one. I haven't tried that one myself, but I have heard nice things about that one.
Seems to be very tolerable. But then that may be just because my skin's quite accustomed to it, so I tend to whack them on. But for starters, I often like recommending that Murad one, which is can't remember the name. It's like sort of youth boosting serum, but it's an over-the-counter product, and it's really very tolerable to many skins. Or
so you can start at any light dose. I think if you what is that one?
This one, Skin Sense, Abby Cleve. It's retinol booster night drops. But now look, you're being very, very good, and so I didn't hear. Did you talk about your own? Because look, what here I've got. Here am I on?
Oh, I'm gonna. Well, we can talk about that's.
We'll talk about that later. Okay.
To do. But for the retinols, I'd say, you know, take whichever brand you like, and if you want to, you know, if you want, and just decide if you want it to be cream based, if you want it to be a gel based, or if you want it to be more of an oil based. And I think that depends on your own skin type. So for more mature skin types and just people who don't like to have too many layering, I like an oil because then you don't need more on top. And then you can also, I like the cream. So if you use a cream, you should wash your face, you put the cream on, the retinol cream on first, and then you put the rest of your skincare on. If you use an oil, then you do it last. So oil should always be the last step in any of your skincare, because it won't if you put anything else on top, it won't go through the oil space. So, you know, you're kind of wasting your time. And sure. I like that people have asked about pigmentation. So I suffer from pigmentation. I just did a CO2
your CO2
I did an IPL and CO2, which has to be done pre-medicated with prescription strength. So I use a hydroquinone and a retinol in combination called Pigmennorm a lot of the year, actually, quite consistently. And so my skin was pre-medicated with that, and then I did the treatment, and then I continue with it afterwards to prevent hyperpigmentation. But whether you have dark pigment or light pigment on your face, you need the same sorts of things. Like retinol is excellent. If you're able to get a prescription strength hydroquinone, that's excellent. Things like licorice, arbutin, there's a lot of azelaic acid. There's a lot of great products out there that help to increase cell turnover and prevent pigmentation from forming. So anything that actually stimulates your skin turnover is going to help too. So I think that's a really excellent product. And like I said, now since we're like kind of stuck in our houses, it's a nice time to get acclimated your skin to something like that.
Yes, to get it retinized. I see somebody saying, what do I know Illumier MD products? I don't know the range very well, but I know they're fab. I haven't tried very many of them.
I haven't tried them either. Sorry.
And somebody saying about Dr. Levy, fabulous, but they are so expensive. What do I really like of his? I like the 3 Deep. It's a glycolic peel scrub wash. It's got it's a glycolic based face cream, so you can put it on like a mask and leave it for 10-15 minutes for more of an effect, but it's got little beads in it, not plastic microbeads, but something dissolvable, and then you can massage that in and then wash it.
Lovely.
That nice.
I'm always for a nice exfoliation. I highly believe in that. Someone also asked about Systemine for pigment. So I carried this a while in my clinic, and I tried it myself, and it has mixed reviews. So for myself, I didn't really think it helped. There are some darker skin types who did use it in my practice who loved it. So I think it really, I think the jury's still out. Could it help? Yes. I mean, there are some excellent studies on it, but I've had mixed reviews. It's not like a hydroquinone. And I have to say that any skincare that you use, you really have to give it 6 to 8 weeks in order to see the benefit, because you know, you need to have like a cell turnover, and you need, you know, new skin. So basically you can't use it for a week and say, oh my God, it's not working, time to move on. Of course, there's some products you can put on and be like, oh my God, I love this product, it makes me feel great. But in order to see the improvement in the face, you need to give it time. So yes, there are a lot of great brands out there. IS Clinical is like a great,
fabulous
great one too. There's a lot of them. So you just have to choose the one that you either want to start with, or one that you already know that you like, or to try something new. So I think that's really important too. But again, remember, anytime you use any of these products, you have to have SPF, and you need to reapply it, especially in this like gorgeous sunshine that we're getting right now.
Yes. So somebody was saying, one of the questions that came in earlier from the post I put up before, saying, does it take 3 months for products to have an effect? So back to that, it's more like, you know, 8 weeks, I'd say, really, because that's even in older sluggish skin, you're going to get a full 7.5 of skin cell turnover in that time, aren't you?
Yes, of course. And really for pigmentation, because it's such a long, you need to go many layers to get to the layer of the pigment. It actually takes even longer. So don't give up if you're on a, you know, if you're using a retinol for pigmentation. Don't give up on it just because a couple weeks later it's not gone, or even a couple months. It is a long-term process, but if you are consistent, and that's the most important thing with skincare, is to have a consistent program that you can keep. If you can keep that program, then really excellent. Glutathione, tranexamic acid, there's a lot of great ingredients out there. There's been some great studies on that. It's not, you know, it's not mainstream, but it's had some wonderful studies on that. And yes, so someone said melasma, and it caused follicle changes leading to blackheads. I haven't read that as a complication. But you have to remember that all of these hair follicles, so if you have something, you know, that has a combination with hydroquinone or retinol, you know, usually it goes into a hair follicle because that's where the sebum is coming out of. And if you know, you're trying to decrease the amount of oil, and so it is possible. And also with melasma, you may have a hormonal component to it, but I don't think it's actually coming from the actual topical ingredient that you're using. But in melasma, it could be potentially something more hormonal that's going on the inside, or you know, not just like, you know, progesterone and estrogen, but even cortisol levels. Like there's a lot of hormones that can actually affect hair growth on the face. So I wouldn't say that I would say that it's more likely something else that's caused the hair growth. And I have, you know, had a couple people ask me that before. So,
wow.
Gosh, you guys are so engaging. I love that you're asking so many questions.
Somebody's saying treating melasma at home. I mean, that Dermatica will get you a prescription strength skincare. Honestly, I'm not paid by them or anything. It's just they're the one way I know of people managing to get these things without actually having to go and see a dermatologist, particularly now everyone's not doing appointments. But sunscreen is the other thing that's absolutely crucial with melasma, isn't it? Because, or with any pigmentation, because any UV is going to kick it off. So
you always have to be really careful when you have melasma. So I have melasma after my second baby. I tell people it's like getting gray hair. You can cover it, and you can, you know, you can get, you can dye it, but it actually always comes back. It waxes and wanes, and it may never go away. And so you have to be prepared. It's like a condition, unfortunately. And, you know, at the end of the summer, despite wearing, you know, literally having like a white face on my face and wearing hats and staying out of the sun, I come back and my skin looks dirty because the melasma has come back. So I try and maintain. It would be much worse if I didn't use my at-home treatments, but you have to use skincare and start off slowly and build yourself up. But I think having a nice exfoliation with an acid is very helpful. Using vitamin C is very helpful, and having retinol and also lightening creams are very helpful. And actually, at-home peels are very nice. So I love the cleansers and treatments that have like dual action treatment. So we have today. So for instance, I don't have any makeup on my face, but I used. I'm gonna say my own just because I have my own, but
yes,
Clarify. So this is an alpha hydroxy acid cleanser that you can use also as a mask. So you can put a thin layer on twice a week to get a deeper exfoliation. And I think it's really important specifically, and especially when you have so much SPF on in the summer months, because, you know, if you're preventing the sun from going in and you've got these lovely ingredients preventing the sun from absorbing, then actually you're not going to get anything into your skin if you don't get all of that off. And so a nice exfoliation twice a week is really important. I also think at-home peels are really nice. Vichy has one that's really inexpensive that you can get from any drugstore, and it has a sequential way of being able to use it. I have, like you have, the 5-day glow serum, which I can't wait to use. I need to give my skin another week before I embark on that. But these Glow Boost ampoules are really awesome. They're so beautiful. I really love them. And so basically there are different cocktails there. Each ampoule has one ingredient in it. So it's like ascorbic acid, vitamin C, meso cocktail, lactic acid, and basically one in the morning and one in the evening. So you wash your face, you break open a capsule. It's a lot of product in one capsule, so you can put it all over your face, your neck, your décolletage. And I even like using it up on my upper arms, because I get, you know, the KPs on my arms sometimes, and it just is a nice, gentle way of exfoliating and brightening the skin.
The KPs, sorry to interrupt you just there, that's the chicken skin, the keratosis pilaris, the bumpy, when you get that bumpy upper arms, you don't need to scrub it away, but you need an ingredient like these to unblock them.
Eat away the keratin heads that have come up, basically. So it's a really nice treatment, and you do one in the morning, one in the evening, and then you can use your routine skincare on top, and then that's a nice way to have a nice glow to your skin without having to go see a doctor or an esthetician or a facialist or anything like that. So I really love these at-home sort of treatments that can be done, and that's why I've done a few of them myself. Just I never have time. So this is the one thing I love about quarantine. I'm taking a bath every night, which I've never done before. I get to do hair masks. I get to do like little facials at home, and I feel like a different person. Has been really nice.
Oh, amazing. Now, look, somebody's asking the brand of these capsules. This is Maryam's own brand. It's called MZ Skin. MZ Skin. We'll tag it, or you can find it through her channels. And Katie, you were asking about the brand I was talking about before. That was Dr. Levy 3 Deep cleanser. I think if you put in 3 Deep cleanser, you'll get it. Anyway, sorry. Try the foot masks. Ooh.
I haven't tried them. I bought them. I bought a foot mask. The kind, it's like, I forgot what the name of it, actually based on another Instagram live I did. So I bought it on Amazon. I just got it. And it's basically like a sock you put on, and then 7 days later you it exfoliates off.
Well, careful, because I found it got rid of a layer of skin all over my feet when I tried these. It was a high street brand, but it didn't get rid of all the built up hard skin. So if you are able to file off the hard skin first, and also I went to yoga a couple of days after doing that, in the days when the studio was open, and it was just embarrassing because every time I moved my feet on the mat, it was like
something was
shedding snake skin, and the whole back of the mat was just like covered with this sort of white stuff.
Well, see, this is why now in quarantine it's good to do, because no one's going to see your scaly feet. So that's actually, I'm going to do that tonight. Thanks for reminding me.
Okay, but yeah, watch how it goes. Do we believe in aesthetic facials? Yeah, totally. Anything that goes deeper, that adds in like a bit of laser, or you know, what's that lovely laser treatment you did, Maryam, as part of your glow?
So I love Laser Genesis. It's a 1064. There's different ones. There's Clear Lift, there's Laser Genesis, and basically it's a long pulse Nd:YAG laser that doesn't have any downtime and helps stimulate collagen production. So anytime you get sort of an aesthetic facial, if you're able to have something, as long as you go to someone reputable, of course, because, for instance, I even like, you know, light lasers, other than just lasers. I like light treatments, like an IPL sort of treatment. I also love LED masks. We have an LED mask ourselves, light emitting diodes, different, you know, red, yellow, you know, different colors that help to increase collagen production, help improve wound healing if you've had a treatment, or like, you know, to soothe the face after a laser or even after a light peel. And there are some of them at home. Obviously, I created one because I love that as well. And if you have one at home, it's never going to be as powerful as what you can get in a doctor's office or in an esthetician's office. But if you use them periodically, maybe 4 times a week, you'll have a really nice effect. I also wanted to say, someone asked about fake tan. I love fake tan, and I use Amanda Harrington's fake tan.
It's amazing.
It's amazing. And I really like that for the face, and also these tan looks drops that works. But if you have melasma or you have pigmentation on your face and you use a tanning cream, that those pigmentations become darker. I don't actually know why. I've done a lot of research. I haven't been able to find the reason why, but for some reason, the pigmentation that comes from those creams sticks onto your own pigmentation more. So I personally, now if I want my face to look tan, I use like a SPF bronzer, and there's a few of them out there on the market. I like the Lancaster one. Shiseido has a really nice one. And it has an SPF, so I can reapply it. But that I would just use a bronzer for my face and not use it with a tan, just because I think that I'm trying so hard to get rid of my pigmentation, and then, like, you know, to put a fake tan and then want to scrub it away. That's not
no. Okay. And the Illumi facial, I see Laser Skin Clinics is sort of saying, yeah. And under the mask, if you have something like this, do you know this one, Maryam, the Viscoderm Hydrogel?
I don't know that one.
It's like from the people who make Profilo. It's pharmaceuticals, and it's a gel patch, and it's you know, you plaster it on. But if you have one of those other hydrogel masks, a clear one, and you clap it on under the light,
you can put lots of things underneath the light. So you can put a mask, as long as it's clear. If it's opaque, obviously the light won't be able to penetrate beneath the hydrogel. I love, you can always use an acid. Someone's asked if you can use an acid of a serum under an LED. I wouldn't use an acid unless it's like a hyaluronic type acid, but you can use any sort of really hydrating creams. I love creams that have a lot of glycerin in them because they actually tend to go into the skin and really deeply hydrate. I love vitamin C as well because it gets, anything that you're doing underneath the LED will have a little bit better penetration. Do not use SPF when you're using your LED because that will obviously block out any light. So the idea behind that. Yes. So, gosh, it's so hard. There's so many questions coming up.
LED mask if you have melasma, or should it worsen? It should be quite soothing, shouldn't it?
You know, there are no studies on that. And I would say what we do know about melasma is that melasma can be worsened even by heat. So like high intensity exercise, using a steam or sauna. So, you know, theoretically, if you get very hot underneath an LED, you could stimulate the vascular component of melasma underneath it. But the LED itself should not cause melasma in and of itself.
Just trying to read this as well. There was a question that came in earlier about, can we use LED mask every day? I think you can, can't you? I mean, they're not
the ones over the counter. You can you wouldn't want to. You can even do them. You know, so if you came to the office and you had acne and you wanted to do something light without having to do, you know, there are a lot of people who don't want to go down either an antibiotic route or oral medication at any point, so they want to exhaust all the options. So blue light, for instance, you can use in an office, and we recommend to come actually, like, you know, if you can, every day of the week for a few weeks to decrease the bacterial load. So the blue light from the LED helps decrease the amount of P. acnes that sits on top of the skin and can be involved with acne, basically. So I think that's something that you should be able to do. And so the home ones, as I said, are even weaker. I would not extend the time than what has been recommended on their instructions, because they've been done, you know, there have been studies done, and that's why they've recommended these numbers. It's not an arbitrary number that we're saying.
Yeah, and Dermalux, thank you. Yeah, that is kind of.
I use Dermalux in my office, for instance.
Yeah.
Yes.
Now, are we going to wear this mask, Maryam?
Yes.
My skin's all clean.
Yeah. So my face is all clean too. So we're going to use and this is actually great for me, particularly also because I did my you know, my CO2 laser last week. So this is called the MZ Skin Vitamin Infused Mask, and it is red. It has lots of really hydrating aloe vera. It has nicotinamide. It has lots of glycerin, lots of hydration in it. And basically, I actually, because it's so hot in my house today, we have so many windows, as you can see, because I keep moving from the light, is I put it in the refrigerator for 10 minutes. Now, one of my patients, so sweet. He told me that to remind people, do not leave it in for two days. It's meant to go in, go in and out quite quickly. So like 10-15 minutes is all you need. And basically,
a lot of serum in this. Which bit do I take off first? Oh, help.
You can use either one. I've never done this on camera, so I'm trying
No,
to
me neither. I'm rubbish at these. Oh, help, help, help. Okay. Right. Either way round.
Yes.
Let's get the...
I've never done a live with a mask too. Oh my God, this is funny.
This is going to be priceless. Let's start at the top. Oh, at least it's a good, oh, it's beautiful. I've got a shiny side out. Is that right?
Yes, it is. Mine is shiny too. It's just the light in my dining room is sort of messing it up.
Oh, well,
make sure.
Full,
you're right. I put it on backwards. That's what happens when you do it inside a camera in your dining room and not in the bathroom. There we go. But so theoretically, if you were lying flat, you could also put them on the eye. They have the little eye bits. I personally, obviously, I'm not going to put anything on my eyes right now because we're on video, but
we won't be able to see where we're going. But this might be better because the last time I had to do a feature for the Mail on masks at the end of last year, and I usually have 5 people in the office, and I got them all to wear them just for speed of testing, even the blokes. And some of the masks, I couldn't get them to stay on my face. They were like falling off in chunks. But this is nice and coherent. It actually holds together.
It is. I really love it. And then the extra lovely, juice that's there, you can put it on your neck. You can put it on your hands. Oh, I like your massage technique. You could use a roller if you wanted. If you had, like a roller, you could use it on top. If you have one of those like 2-prong things, you could use that as well. I wouldn't use it. You could even use it with a jade roller on top too, but you don't really need to. And I wish I was wearing it sleeveless. If I had your arms, Alice, I would be wearing it sleeveless. Let me just tell you. But it fits really nicely, and we're both standing up, and this is hilarious. I know it is hilarious.
Yep. But it's great.
My husband's probably laughing at me in the other room. I think he's on watching.
Yep, this is cool. This is real. I mean, this is what we do, and
you have such a fun job. You get to try everything. I want to be you, Alice. Like if I didn't work in my office, I would literally be trying treatments all day long. Yeah, I do try everything. That's how I do my research. I go around, I try lots of different things, and I see which ones I like, and then I have to say my own range. The reason I have so much with Pigment is I always feel that people want to have clear skin. So whether it's pigmentation, blemishes, redness, it's always about having that no foundation sort of look. And I've tried to create products that are sort of done with that in mind. And of course, pigmentation is one of the things that I find really annoying. So I've really done a lot for that. And I think it helps with all skin types because, for instance, if you suffer from blemishes, for instance, you get post-inflammatory hyperpigmentation if you touch things too much, or even if you don't touch things, you can have that. So all of these ingredients are to lighten that and to decrease that possibility of having, pigmentation. So let's see, there's so many.
I'm missing the one with the hydroquinone.
Yes, I can't read it very well.
That is difficult, and that is very specific.
I think it all depends. Again, you have to also remember if you, for instance, had any laser hair removal on the face and you had like very fine vellus hairs and you've done a laser, sometimes you can stimulate more. I mean, I would love to help, but I think a larger history needs to be taken in order to determine what what happened from that. So
must have skin product. That is the most impossible question. What is your one must-have product? I mean, I normally go for something boring like the sunscreen, just because that is what I would wear every day, and I don't mind if it's a cheap one or an expensive one, as long as it just, as long as it's there. How long do we leave the mask on for?
You can leave it on anywhere between 10 and 20 minutes. If we want, we can take it off at any point. I would say, I think we've had like 6 minutes with it. I think I love so. Yeah.
Fantastic. Oh, is there anything else you want to talk about before?
Well, the other thing I wanted to say is, if you want to, you know, for at-home treatments and things like that, I think doing light peels and acid peels at home is really nice. I think doing LEDs and these sorts of hydrating masks. I like to do this when I'm in the bathtub now, which I don't have, which I've never had the option of doing. I would also say to get your products to last longer. You know, it's a very stressful time right now, and I love that beauty is a way to lighten things up and to do a little bit of self-care and hopefully take you away from all the craziness that's going on in the world right now. So even if it's one thing that you decide to do for yourself, whether it's in the mirror using, you know, even just a little bit of any moisturizer you have and giving yourself a nice facial massage, or taking a relaxing bath, or, you know, just doing a little bit of meditation and doing something fun. I'm, you know, I was saying that I want to meditate with a mask on because, you know, it's kind of nice. You're just sitting there and it's so cooling, and then your mind also switches off. But I think that all of these things are meant to make you look better, but also make you feel better. And, you know, the way you can extend things are trying to do things that are good for yourself. So, you know, we're still allowed to take a walk, enjoy the beautiful air. You know, try and do things to, I've shut down the news. I don't listen to the news anymore other than to just check on our prime minister. But I don't really like to have, you know, all the negativity. And you just try and look at the positive, the beautiful sunshine, the time you spend with your family. I'm going to change my closet over, going from winter to summer because I have no clothes to wear. But like, you know, those types of things. So, and I would say you can take care of your body too now. So I also brought, I mean, you know, a few of my favorite things too, because, you know, just not to make it so focused on mine.
Okay, sorry to interrupt, somebody was asking which was your favorite product from your range.
Oh my God, I love them all.
Which you're allowed to say.
But right now, what I'm really obsessed with, which is coming out this month, is our Tint and Protect. So this is a slightly tinted moisturizer with an SPF of 30. I think it's a great product for most skin types. I would say from you know, Fitzpatrick 1 to 4. It's not great for the darker skin types, but it gives a very nice sheen without looking white. Because one of the greatest things that I believe in having a combination of chemical and physical SPF. Chemical is when you have to put on the SPF about 20 minutes before you go into the sun. It goes into the skin and it absorbs the UV rays, so that UV rays don't create damage to your skin cells. The way that a physical one is where it actually reflects the light. They're the ones that make you white. So I really believe in a combination of the both. And so this is a combination of both. It's not enough if you're going to be on a beach setting, but for everyday life in London, you can always top up with something on top. I think it's really great. It gives a nice sheen to the skin, almost like a primer without having any of the nasties in it. And then I go on with my normal skincare. So right now I couldn't live without that because I'm not a foundation person generally. And so I like the fact that I get a little bit of coverage and I can just put a little bit of bronzer on top. So that's what I would say is like my one thing that I can't sort of live without during the day. And at night, I just love my placenta. So I love anything that has stem cells, anything that's deeply hydrating. I have more mature skin. I'm prone to being more dry. And so I really like to hydrate my skin without becoming oily. And I think that's a really great one. So, and then for the body, because I have KPs and stuff, I mean, two of my favorite ones, which I'm running out of, are Ameliorate. And,
that's brilliant, yeah.
And I actually really also like, we don't make body products yet,
yes,
but this exfoliant retexturing treatment.
Wonderful, yeah.
These are both really great products to help exfoliate all that dead skin on your body. And if you want to do a fake tan, make sure you exfoliate your body first, either using a brush or, you know, a chemical, you know, cream. And that's what's really nice about those.
Fantastic. Well, thank you so much, Maryam, for your time and expertise. Somebody was saying how much they love your PT sessions, and yeah, you know, we've been talking for months, and so we are well.
I know, and I was going to do it, and then this lockdown happened. Well, we could do a joint Zoom one. So I did my trainer today, and he's on Zoom in the background on my iPad, and then my son goes and records it every 2 seconds. But, you know, the reason we started recording was because when I record, I don't cheat. But if I don't have any camera there, I tend to cheat. So it's actually for more motivation. I
you know,
swear.
for people who haven't seen these, you'll see them on Maryam's stories, and I know that you pack these in late at night, you know, after you've done a full day, after you've got the kids to bed, you know, so you make sure you get them in, which is very impressive. And they are not easy. I sit there looking and thinking,
Oh, I'm sure you can do them. I saw your push-ups the other day. They were amazing. Wow.
You only saw about 5 of them. I'm not sure there were more than that. Anyway,
I think there was like 20 of them.
We'll do it one day. We will do it. But look,
I'm going to take mine off before
Yeah.
we get off, just so I can show everybody what it looks like. So, you know, I then also just, you know, moisturize it in. You don't have to. You could wash it off, but I like
what a
to keep
waste.
it on. Yeah, what a waste.
You are going to push it right up into my hair and smooth it all.
I just washed my hair for you today. After I was like sweating so much from my PT today. And I had my face covered in SPF, so I was like really trying to get rid of my SPF.
Okay, so that's good. That's good, isn't it? It's looking nice and bouncy and feeling all smooth and hydrated.
And I feel more relaxed. Thank you. Thank you for making me do a mask online.
That was amazing.
Time for everything.
Lovely treat. Well, have a lovely weekend. And I'll
thank you. You too.
People have been asking. I will put it on the main grid as well. Okay. Thanks so
great.
much.
Thank you so much.